Hi, I'm Dr. Catherine Beck with the Utah Center for Minimally Invasive and Bariatric Surgery at Jordan Valley Medical Center. I will be presenting an information session entitled, What are the types of bariatric surgery? There are 3 types of bariatric surgeries: laparoscopic gastric banding, sleeve gastrectomy, and Roux-en-Y gastric bypass. Laparoscopic gastric banding is shown in this picture. A rubber tube is placed around your stomach to create a small stomach pouch separate from the rest of your stomach. It is attached to a port that is under your skin. That way, the band can be tightened and loosened with a needle and saline in clinic. The advantages to laparoscopic gastric banding include excess body weight loss of 40%. It is not needed to cut the stomach. There are no new connections between the stomach and the intestines. Only a short hospital stay is needed. It is reversible and adjustable, and there is a low risk of vitamin deficiencies. The disadvantages include a slower weight loss, a foreign body being implanted into the abdomen. The band can slip and erode into the stomach. The band can cause damage to your esophagus. It requires strict compliance and lifelong follow-up, and it has the highest rate of reoperation. A sleeve gastrectomy is shown in this picture. During this surgery, the majority of your stomach is removed. This leaves only a small gastric sleeve, the shape of a small banana. Through this, you will eat and your food will be stored before moving into the intestine. The advantages of a sleeve gastrectomy include decreased amount of food that can be eaten, positive effects to the neurohormonal response to hunger so that you feel less hungry, weight loss comparable to the Roux-en-Y gastric bypass of about 50 to 60% of your excess body weight. No foreign bodies are implanted into the abdomen. There are no new connections between the stomach and the intestines, and only a short hospital stay is needed. The disadvantages to a sleeve gastrectomy include it is not reversible, there is a potential for vitamin deficiencies, there is an unknown effect on reflux disease, and there is a possibility for a leak from the staple line. A Roux-en-Y gastric bypass is shown in this picture. During this surgery, we create a small gastric pouch and detach it from the rest of your stomach. We then create a new connection with your small intestine so that when you eat, food goes into the small gastric pouch and enters the new connection with the intestines. This means that you can only eat a small amount of food and that your food bypasses a significant portion of your digestive tract so that less is absorbed. The advantages of a Roux-en-Y gastric bypass include a decrease in the amount of food that can be eaten, a decrease in the absorption of the food that is eaten, no foreign bodies are implanted into the abdomen, it treats reflux disease, and it can be done on patients with gastroparesis. The disadvantages of a Roux-en-Y gastric bypass include the potential for vitamin deficiencies, it is not reversible, lifelong compliance is essential, and there is potential for obstruction of the intestines and for an internal hernia. Our team of experts will help you choose the best procedure for you. To get started, call 801-964-3855 to make an appointment.